Okay, guys, one more on healthcare, and then I'll leave you alone. I promise to get to some other stuff. Uh, I'm going to have some cooking demonstrations on here. I'm going to have some what I call comedy. You may not call it comedy, but just funny ranting and raving. But I got to get one more in on this healthcare deal. If you've watched both of these, I've already probably taken up more of your time than I should, but I have to mention one more thing. Government involvement in healthcare cannot be a bigger disaster as of an idea, let's say. We already have a great example of what socialized medicine will do to the quality of care, and we have to look no further than our own Medicaid and Medicare system taking care of the poor and seniors here in America to see what kind of care our government provides. And we could go on and on and on about the abuses and the waste and the fraud that comes hand in hand with the government-run monopolistic system of healthcare, where dead people are receiving benefits, or actually live people are receiving benefits in the name of dead people. But we'll skip through all of that, which would be a disposition in itself, and mention one major thing that you lose in a monopolistic system like that is innovation. You know, in the private system, we have tons and tons and tons of tests, procedures available to us now that are considered common that didn't even exist as recently as 30 and 40 years ago, because the innovation in the medical field has just been amazing. My wife had a procedure done where she had a brain aneurysm, and they went in with a micro catheter, a very, very, very small catheter, went through her blood vessels in her brain. Then they had a coil that they were able to push out of that catheter once they got to the correct destination, and they put this coil inside the bubble that had formed in her blood vessel, and actually cut that part of the vessel off, so it wouldn't receive blood flow anymore. It wouldn't be at risk for further damage to that aneurysm. Just an amazing procedure when you think about it, everything that was involved. They had cameras that I saw pictures of from inside her brain, pictures that would just blow your mind, pictures of the aneurysm itself, pictures of a balloon on the outside of that aneurysm that was not bigger than a BB in real life, and I saw it on screen like this. So all these amazing innovations that the private system has come up with. Government-run systems, on the other hand, don't have such a great record of innovation. Until just a few years ago, our government-run healthcare system did not cover prescription drugs. The last time I checked, prescription drugs were a pretty basic function and a basic product for healthcare consumers, available to almost anybody with private care. Yet our government said that was one area that they could not afford to cover. So it makes you wonder what type of coverage you'll be able to get. You won't have access to the innovative new technologies. You won't have access to procedures that are considered out of the realm of normal, experimental, alternative procedures. You won't have access to any of that stuff. Matter of fact, my guess is that they'll take what's available now and they'll shrink that and cover, a small portion or a smaller portion of what is even available today. Now, when you get into the innovations, the procedures and technologies of healthcare tomorrow, that stuff will never come in to be covered. Matter of fact, the government coverage tends to shrink the longer the system is in place. So those innovative new technologies will never be available to a government-run health insurance, a patient covered by that insurance. You know, and of course that leaves the middle class and the poor receiving the worst care, because they're going to have to be taxed heavily to pay for this. And it's just like your public schools. Public schools are some of the worst schools available to us, especially for the poor, the minorities, and the middle class. The rich still get pretty good public schools, and if they don't like that, they can go into the private system and they can pay $4,000 or $5,000 a year for better schools than what the government provides, because they have that money. The same system, the same thing will hold true in a government-run healthcare system. The rich and the well-to-do will still go outside and receive great coverage, but the poor and the minorities and the middle class that will be taxed heavily to pay for this government-run healthcare system, they'll be stuck, because they won't have the extra $5,000 a year to go out and buy good insurance on their own. So, benefits of capitalism: the middle class, a lot of the poor, a lot of minorities, even though it's not perfect, still can get good coverage, still can have access to innovative new technologies, still can have access to alternative treatments and things like this. Because as bad as it may be, the insurance companies are still willing to pay for a lot of that type of stuff, because it's a benefit to them, because they can pay for this. You know, they can pay for an MRI rather than brain surgery, you know, as it were. So benefits of capitalism: the poor still get good coverage. Won't be like that if we do away with what little capitalism is left in our healthcare system. All right, I'll leave you alone on healthcare. Coming back on more later on.